topic entitled Nighttime Peeing and its number one cause. We all know that nighttime peeing frequently, if you pee more than once at night, it is not normal. And that many people these days are passing urine 2-3 times, and because it's so common, people feel it's even normal to pass urine like 2-3 times at night. But it's not normal. If something is frequent or is common, doesn't mean it's normal. In the day, what is normal is 4 to 7 times passing urine, and at night is 0 or once at night. But there are some factors that can disrupt, or I can say number one factor that can disrupt how our antidiuretic hormone, specifically is called vasopressin, which should command the kidneys while we are asleep to hold on onto water so that we can sleep 6-7 hours continuously. This number one cause can disrupt the way this hormone should work. But there are other factors that can make people pass urine often, but they are not the masters. For example, poor habits before sleeping, drinking too much water, tea or coffee or caffeine or alcohol, they all can lead to frequent urination at night. If you drink too much during the day, definitely, and you eat too much salty meal late in the evening, it can contribute to that. If you can sleep at night well, you have insomnia, it can make you pass also urine. It's not the cause, but because you can sleep, you automatically rise to pass urine. There are medications that people take, like those diuretics, these water pills, especially blood pressure medications, or people taking medication for depression, or antipsychotic drugs, or heart drugs, or steroids, sleeping medication. They all contribute to frequent urination. Those people with prediabetes or type 2 diabetes, or diabetic condition called diabetes insipidus. This is a condition or diabetic condition that will disrupt the vasopressin, that is antidiuretic hormone, not to work. In that case, your kidneys cannot hold on onto water while you are asleep. Overactive bladder, it means the wrong signal being sent to your bladder will cause overactive bladder. That also can cause frequent urination. Bladder infection, UTIs, can also lead to frequent urination at night, but that is not the master cause of frequent urination. Interstitial cystitis, that is a long-term condition or chronic bladder condition where the bladder wall gets irritated or inflamed. That will make the bladder feel full and make you feel that you have to pass urine often, but that is not the master cause here. Men, enlarged prostate. If you're a man, you have enlarged prostate, well, it can cause frequent urination. But then if your prostate is normal size, being a man, and you still have frequent urination, then the master cause is the cause here. Prostate inflammation, of course, prostatitis, can also cause that in men. Women, pregnant women, because of hormonal changes. Heart failure can also lead to frequent urination. Sleep apnea, in this case, your oxygen level may drop because your breathing may cut off and start again. Kidney disease can also cause frequent urination at night. Low bladder capacity. Aging, as you age, you cannot produce this antidiuretic hormone, enough of that, because your liver, which regulates hormone, may not be working, and you may not be able to produce that to command the kidneys to hold on to water. It's in menopausal women or menopause. When a woman has menopause, the estrogen goes down. That can cause also problems with the bladder and the pelvic. But not only that, it causes problems with the heart, bone, and many more. You see, number one master cause of frequent urination, beloveds, is insulin resistance. Insulin resistance is when your body cannot respond well, especially your muscle cells, some of your muscle cells, fat cells, or your liver cells cannot respond well to insulin. Insulin is supposed to open up your body for your body to use the glucose for energy. But here's the case, you have more insulin in your blood for a long period of time, it can disrupt the antidiuretic hormone, the vasopressin, and that can lead to frequent urination at night. That is the most common in both men and women. Apart from that, it can cause your bladder walls or muscles and then pelvic floor to be weak, because it will disrupt hormones in both men and women. That is insulin resistant, and can cause also disruption of nerve supply to your bladder. So insulin resistance is the master cause of peeing frequently at night. I hope you've learned something today. If you have this problem or any other chronic problem, reach me on this number. If you're calling outside the UK, it's +44 738 464 7300. If you want to learn more about my videos, visit me on my YouTube channel. Put in Dr. James Natural Link. Dr. James Natural Link. When you go there, subscribe and support the channel. Thank you for